Hello, this video is centered on the post-exposure prophylaxis of rabies. My name is Oben Kenneth, a student of the Faculty of Veterinary Medicine, University of Jos. I represent the International Veterinary Student Association, IVSA, University of Jos chapter, and I will try to make this video as short and as precise as possible. Rabies has the highest case fatality of any infectious disease. As you can see on the chart, rabies topping the chart, followed by Japanese encephalitis with only 12%, while rabies has 100% case fatality. When a person is exposed to an animal suspected of having rabies, the risk of rabies virus transmission should be evaluated carefully. Risk assessment should involve consideration of the species of the animal involved, the prevalence of rabies in the area, whether exposure sufficient to transmit rabies virus occurred, and the current status of the animal and its availability for diagnostic testing. What medical care would I receive if I may have been exposed to rabies? Basically two: wound care and post-exposure prophylaxis. Wound care, first and foremost, has to do with immediate gentle irrigation with water or with dilute water povidone iodine solution. And this dilute water povidone iodine solution has been proven to greatly reduce the risk of bacterial infection. Also, tetanus shots should be given, be it tetanus toxoid, tetanus antitoxin, or both. And then antibiotics to reduce secondary bacterial infection. Post-exposure prophylaxis consists of a dose of human rabies immune globulin, popularly known as HRIG, and then rabies vaccine should be given on the day of rabies exposure, that is day 0, and then subsequent doses should be given on days 3, 7, and 14. For people who have never been vaccinated against rabies previously, post-exposure prophylaxis should always include administration of both the human rabies immune globulin and the rabies vaccine. While for people who have been previously vaccinated or are receiving the pre-exposure vaccination for rabies, they should only receive the vaccine. And then there are some adverse reactions that accompany administration of post-exposure prophylaxis, or as it may be known, post-exposure anti-rabies. And these reactions are not common, but are seen in some cases. Mild local reaction to rabies vaccine, such as pain, redness, swelling, or itching at the injection site, are seen in some cases. Rarely, symptoms such as headache, nausea, abdominal pain, muscle aches, and dizziness have been recorded. Local pain and low-grade fever may also follow injection of rabies immune globulin. I hope this video makes sense, and I hope it has helped to improve your knowledge on post-exposure anti-rabies. Thank you and goodbye.